So first, I'd like to ask your permission to use this video for educational purpose and on internet.
Yes.
I just heard, I know, do I have as well your permission? Okay, so I just heard that you beat her to the lunch. Is that right?
I did. I was hungry.
And we are just what? Not even half an hour after the surgery, right?
No, about 15 minutes.
Yeah. So how do you feel?
Wonderful.
Yeah.
Absolutely wonderful.
So we did a sacroiliac joint fusion. Now the advantage is that we didn't put you to sleep. We did it with
Right.
just with conscious sedation, and that truly changed that. You can recover faster because you don't have to get rid of all this medication in your system. Tell me about your system in your sacroiliac joint. What were the symptoms?
So what I had is a lot of stabbing in my upper right butt cheek area, and then it also came across not the stabbing but nagging, just frustrated area.
1 to 10, how bad was the pain?
Most of the everyday was 8 to 9.
8 to 9.
And it would spike up. Very little would it come down.
How did we figure out it was your sacroiliac joint?
You had asked me to turn around and point in one of our visits.
Yeah.
And I pinpointed it on there. It felt like a hot screwdriver got stabbed into me.
And then, but as well, we send you for some injections, right?
Yep.
Describe those injections. How did they help you?
It did depend on who did the injection and how much of the Novocaine.
Yeah. That's important fact because these are difficult injections. It's not a straightforward. This is one of the hardest joint to inject. Sure. But the idea is that if you put it in the right place, temporarily pain goes away, then that's where the pain is coming from.
Yep.
Is that what happened?
Yes. So from the numbing agent that you put in, I got up to 3 hours worth of relief. And then it came right back, which sucks.
Yeah. Like the dentist, numbs it up, start rolling, later on pain comes back.
Yep. But once you did that, it was numb. I could wash my truck. Played with my kids. So that was huge.
The surgery just got done. How did it go? How are you?
I'm feeling great so far.
Yeah.
It's been 15 minutes ago.
Yeah. Do you remember we told you not to step on that side for a while? What did we tell you?
You told me no weight on there for 2 weeks, minimum of 2 weeks.
Yes.
But kind of take it. Everybody's going to be a little bit different.
Yeah. And you use a walker to walk for a little
walker.
bit. Okay.
Yeah.
And the rest of it is, usually people have 2 sacroiliac joints, and this is one of those surgeries that doing one side is actually protective to the other side because you can use it more. People we know they have problem on both sides. When we fix one side, half of them they come and say the other side is good, and we don't do it.
Right.
But half of them, it's almost random. We haven't figured out what characteristic or criteria indicate that we need to do the other side. So there's a good chance we are done.
Sure.
But there's as well a chance that we have to do the other side. We'll see.
And this was very minimal invasive. Very. It doesn't feel it.
Yeah. We lost less blood than a spoon.
Sure.
And the surgery was less than 15 minutes. That's all what it was.
Yeah. It went wonderful.
Yeah. Well, thank you so much. I appreciate it.